Hello, Dr. Heap and fellow SLP colleagues. Today I'm going to be discussing alternating treatment design. My research question and claim: in speech-language pathology undergrad students, which instructional method is more effective in teaching clinical interviewing skills? Standardized event with a standardized patient or computer simulation such as Simulcase? Simulcase is a computer-based simulation program in the field of speech-language pathology to teach students how to treat or diagnose and treat a computer-based patient or avatar, while a standardized patient simulation trains actors to portray a particular illness, disease or disorder so a student can diagnose and or treat the patient. The purpose of the current study was to determine which instructional method is more effective in teaching undergrad SLP students how to conduct a clinical interview of a patient. It is my hope that SLP undergrad students will demonstrate improved clinical interview skills after participating in one of two instructional methods to teach clinical interviewing skills. Participants are undergrad students enrolled in California State University San Marcos Bachelor's of Science in Speech-Language Pathology program in their last semester of the program. Inclusionary criteria includes B or higher in all foundational SLP courses. Exclusionary criteria includes participation in Simulcase or other simulation activities and previous experience interviewing clients in any field. The environment in which the investigation will be conducted is in a classroom setting at CSU San Marcos. The independent variables would be the Simulcase and standardized event with a standardized patient, and the dependent variable would be the percentage of asking open-ended questions during a clinical interview. It is expected, given the research question independent and dependent variables, that the SLP students will demonstrate an increase in percentage of open-ended questions asked in a clinical interview by participating in either Simulcase or standardized event. It's expected that at least 60% of the questions the SLP students ask will be open-ended by participating in both or either of the interventions. As demonstrated in the graph, the percentage of open-ended clinical interview questions asked by SLP students increased after participating in both types of interventions. So here I have the baseline, and then here there were 10 sessions of the intervention. As I said, the participant completed 10 interventions of Simulcase and standardized event during the same session, with each intervention lasting 30 minutes. For half of the sessions, the standardized event intervention was administered first, and then Simulcase was administered while the other half started in the reverse order. First Simulcase and then the standardized event. This occurred to prevent potential order effect. The performance of the participant increased quicker and with a higher percentage of open-ended questions with the standardized event, regardless of which intervention was delivered first. In Simulcase, the participant's performance did improve. However, it was slower and not as immediate, and overall percentage of open-ended questions asked was lower. We go back to the graph. In looking at the graph, intervention with Simulcase, and that's here the red line, series 2. So intervention with Simulcase increased with asking open-ended questions more quickly, with standardized event occurring first in the session. Sessions with Simulcase administered first resulted in a much slower rate and with an overall lower percentage of asking open-ended questions. The standardized event intervention appears to have faster results, and it could be hypothesized that it helped with the participants' progress in using the Simulcase intervention. So the blue line would be the standardized event, and then as I mentioned, the red line is the Simulcase. And so you can see here that with the standardized event, with a standardized patient, it was faster and higher increase of asking open-ended questions. Simulated learning experiences are an effective alternative method for bridging the gap between academic knowledge and clinical skills. In simulation, scenarios are created to replicate real health encounters to replace real patient experiences. Professors have used simulation experiences to build knowledge and experience through practice and rehearsal in a safe environment. So it can be said that it's low risk and high gains in simulation experiences or activities. It helps develop such skills as critical thinking, clinical decision-making, effective communication with patients and colleagues, and increased confidence when working with clients in real-life situations. So the purpose of this investigation was to determine the effectiveness of two simulations, the SimuCase and then the standardized event using a standardized patient, to improve clinical interview skills in an SLP undergrad student. An alternating treatment design was used to determine the effectiveness of the two simulations. And the results of this study support the use of simulations in improving clinical interview skills in speech-language pathology undergrad students. It appears that the standardized event intervention with a standardized patient is more effective in teaching interview skills. Thank you.